Privileged to be here today. Some amazing innovators. I'm going to talk to you about our total digital surgery solution. My name's Sandeep Chauhan. I'm a practicing orthopedic surgeon and the co-founder and CEO of Definition Health. I lead a team of 20 different clinicians and an experienced board in launching this. So a bit about my journey, because this is a relationship type meeting. I've been an innovator for the last 20 years. This is a picture of me at the American Academy meeting. I had a bit more hair then in 2002, launching computers in surgery. And I pioneered computer navigation globally, taught over 500 surgeons throughout the world. And it's an interesting experience being an innovator. But as an innovator, you have to challenge convention as well. During that journey, I spoke to my American colleagues. All of them had their own private surgical centres. And I always said, well, why can't we have this in the UK? People said you couldn't do it, and I decided you could. And £45 million later, we built the first in Brighton. And data for me has been hugely important in my surgical journey outcomes. And the data at the bottom here, that complicated graph, is from our National Joint Registry. It is the best registry in the world. It has the most patients in the world, and we are mandated to register all our patients and all their data in that registry. Every year it gets produced, and those complex blue dots are every surgeon in the UK. The further on the right you go and the lower you go, the better your results. And I'm pleased to say 2,212 is me. The combination of technology has helped me become a really, really good surgeon, being innovative. Our mission, from our experience, is to change how we deliver surgical care globally. So whether it be in the UK now, in Africa, where we've also deployed, or in America, where we're going to deploy, can we use effective digital communication monitoring to improve care? Because the problems we face globally, not just in the UK, is there are millions of patients waiting to have surgery. In the UK alone, 6.8 million patients waiting. And those patients have no visibility about their treatment options. Often the materials we give them as professionals are really quite poor. They don't understand them. And from a hospital point of view at the bottom, we're massively understaffed. You heard that from Bernard if you're in the earlier talk. And it's not difficult to understand in the US why that's a problem, because Walmart pays $35 an hour to stack shelves. That's why they're losing all their nurses in the US. We have agendas, national agendas, such as zero carbon footprints. And one of the problems we have is unless we actually get patients along that journey correctly, we lose operating time and space. And operating theatres are the engines of most hospitals. And in the NHS, it costs us between £200 and £400 million a year of lost revenue. Now, when the patients had their operation and they go home, they often feel isolated. And that leads to reattendance to hospitals or the acute surgical centres in America. And the problem is, in the UK, 30-day readmissions cost us £1.2 billion. So how do we solve this? Well, by using digital technology, we can track patients. We can help augment their journeys. They still want to see surgeons. They still want to see the whites of eyes, but we can augment them and actually avoid appointments. We can change how we deliver information. We consumerize that information by delivering the right information to the patient at the right time, which has added benefits because it draws in their families and friends and their support networks, which actually makes their care much better. We deliver all their information in one place and improve communication. That saves lots of money. From a hospital point of view, what it does is it improves efficiency. It enables us to identify risks really, really early in the surgical pathway to start optimizing patients as opposed to just before surgery. The solution has a patient app which is delivered, and each patient is securely linked to a hospital. All their information is delivered to them, and they, as patients, deliver all their health information to the hospital, remotely, securely. It's great because patients can do this at home. You don't have to take an hour off work to go into hospital and do this, so it's very time consuming. Hospitals then receive that information and can start optimizing patients really, really early. And optimization is really, really key. A big US study of 4 million joint replacements done in multiple centers in the USA showed that failure to optimize costs hospitals up to $3,000 per case. It also, by just following a clinical pathway, improves coding revenue for hospitals. So we prove time and time again that we can improve hospital revenue by improving their coding. Bill Roach showed in Florida that failure to code 10 key comorbidities cost up to $2,000 per case of lost revenue. So our value proposition simply is for patients we improve communication. we educate them better, and we reduce hospital visits. For hospitals, we are improving their efficiency, improving cost savings, and reducing the manpower pressures we face as clinicians every day. And actually, for the wider health economy, having better prepared patients is good for all of us. We waste less resources, and we improve our net carbon position by reducing travel, reducing paper, and all those other aspects associated with the patient. And we have lots of real-world evidence to show this. We've done lots of studies that are independent, which show improved capacity, improved efficiency, and reduced costs. And because of this, we awarded a National Innovation Fellowship here in the UK, which is fairly prestigious, to roll out our technology throughout the UK to help hospitals recover from COVID. Prior to that award, we had over 100,000 patients go through the system. It's very effective. Multiple hospitals, multiple advocates, multiple awards. The key thing now is we have even more traction in the NHS here in the UK. Multiple hospitals, these are examples of the hospitals that have signed up within the last 6 months, ranging from mid-sized hospitals to the biggest trust, the biggest hospital in the UK, Barts NHS. We put £2.4 million of seed investment into the project. We've increased our revenue by 400%, and our first US revenue is shortly going to arrive. Underpinning this key clinical aspect is our data platform. Because as we collect data from patients before the operation and after operation, it all gets delivered into our data platform. To date, we have over 100,000 data sets. That's 100,000 patients, not individual points, 100,000 patients of their data. By 2023, we have 300,000 patients. And the key is we can connect the whole pathway. So patients pre-health to what happens to them afterwards. And actually, using deep AI, we can start learning about what patients, for what procedure, have what risk. And we can start modifying what we do to those patients beforehand to prevent those complications occurring. Just as importantly, we can collect intraoperative data. The little diagram or graphic on your right is robotic surgery. It's the data we get from robotic surgery. And that's really important for you to understand, because the graph I showed you on the second slide was 18-year follow-up. Robotic companies can't wait 18 years to prove the evidence that their technology works. We need to get it much, much earlier. And on your right was a simple video taken and downloaded onto the platform. When I started as a trainee surgeon, we had paper. Now patients want video into their files, into their media. They want to know what's going on with them. From that data platform, we can get health population data about specific procedures. So, for example, this is the hospital wants to know about its prostate cancer patients. On the top is robotic prostatectomy, on the bottom is radiotherapy for the same group of patients within that hospital. We can give them the information at a snap of a finger. We can deliver data-driven education. So this is 35,000 patients, and in 7% of them, we found they have type 2 diabetes, a risk factor for surgery. We're able to deliver automated education and monitoring. And we control pathway design as well. Our market, the surgical market globally is about £35 billion, and our customers range from surgeons at ASCs in America to hospitals, medical device industries, robotics, public health, and pharma. And our business model is a simple SaaS-based business model for our modules. Our entry into the US, which we've just started, is by a partnership with a US robotics company, with a distribution network, and interoperability with EMR systems. So our ask is simple. If you're strategic in the room, in the surgical field, we'd love to talk to you. Can we help each other's journey? And if you're an investor, we're about to start our round. We'd like to learn more about you and you about us. Thank you for your time.